There you are. How are you today?
I'm great. How are you?
I am doing well. I appreciate you taking time to talk to us. I just wanted to kind of see if y'all could give us a better understanding of the Volunteen program so that when we're trying to tell students about it, we can actually speak with a little bit of authority on it. So if you don't
Absolutely.
mind.
Sure. So the volunteer program with Wellstar has been around for a long time. I don't know how many years. I've been with volunteer services since 2015, and it existed long before that. But it is a program that allows students who are interested in a career in healthcare the opportunity to volunteer in the hospital setting. So what that does for the students is two things. One, it allows them the opportunity to be in the hospital and kind of see what it's like on a small scale. They don't get to watch brain surgery or anything, but they do get to see what it's like to work around healthcare professionals and what the hospital environment is like and see different careers that are available in the hospital. For example, who knew there was a director of volunteer services? It's not all just clinical positions. So it allows the students those opportunities, but it also then allows them to serve the community and get those volunteer hours that they might need for service clubs. Looks good on their resume, looks good on college applications. It's good life experience too, because we require an application, we require paperwork, we require an interview and professional dress. And it is a competitive program because we have only 50 spots and we always have more students than we do spots. So it is an opportunity for the students to put their best foot forward and just gain some life skills also in addition, even if they're not accepted into the program, to have the experience to interview with an HR professional.
Yeah.
And just it's just good life experience for them also.
So, assuming a student gets into the program, what is that looking like in terms of how long is the program and things like that?
So the program is in the summer months, it's June and July. So students would be asked to volunteer for 1 4-hour shift per week for the 6 of the 8 weeks of summer. So we know that students have so many other things going on. We don't require them to be there every week, but we do require that 6 week minimum commitment because that gives them the opportunity to really benefit from their time on our campus and also gives our departments the benefit of having someone that has a little bit of experience. We have expanded the program a little bit so where we do have some year-round opportunities. So if students enjoy volunteering in the summer and would like to continue volunteering during the school year, we are allowing that now. Historically, we have not. We've just kept it to the summer hours or the summer dates, but we are kind of expanding that. It can be a little challenging for some students who are very involved with school and other activities, or they may have other jobs or other volunteer commitments. So volunteering during the school year is not for everyone, but we do have that opportunity available that students could continue and earn more volunteer hours if they so chose.
Okay. And so when they come in, are they kind of doing a rotation into different departments, or is it something where they come in and kind of express an area of interest and get more experience in that area?
So we do assign them to one place. So they would volunteer in the same department, same day, same time every week. What we can do to enhance the opportunity for them during the summer is we do offer some educational opportunities that give them a little more experience. In the past, we've had a trauma day where our trauma team does some training and a trauma simulation for the students. We've had an OR day where they get to go and experiment with the robotic equipment that's used in surgeries. We have a career day where different healthcare professionals will come talk about their job and how they how they got into it, what do they love about it, and what was the education required. We've had respiratory and pharmacy day where we take tours of those departments as well so students can see different areas in the hospital. But in order for the experience to really benefit both the student and the department, we found that they need to stay in the same assignment each week, because if they hop in from different departments each week, they're not really learning anything about that department, and the department really doesn't benefit from having their help because they don't really know what they're doing.
Yeah.
But if they stay in the department for 6 weeks, after a week or two, they know what to do when they get there. They know how to help, and it benefits our staff and our patients and visitors a little more than it would if we had them just rotate areas.
Okay. So what would you say is the one thing y'all really look for in a volunteer?
I would say a sincere interest in a career in healthcare and the desire to serve others. So it's mutually beneficial because we want the participant, the student, to really enjoy the experience and get excited about a career in healthcare and maybe even work for Wellstar one day. We do have opportunities for high school seniors in some areas. And then certainly moving forward, students can work and go to school at the same time when they're in college. And Wellstar has an education program where they do tuition reimbursement. So we would want to expose the students to those opportunities as well. So it benefits the student in that way. But we also want them to have that sincere desire to give back and serve in the community as well, and have it be, a selfish interest in a way. And selfish is not a bad thing there, and that they want to benefit themselves, but they also want to help others too. So we're really looking for that. We do have certain requirements. There's a 3.0 GPA, and you have to get a school counselor recommendation and submit some paperwork as far as your health. We have to have immunization records and things like that. Those are basic requirements.
Yeah.
But to go above and beyond and to really stand out, I think if somebody just has to really be able to convey their true interest and their true desire and what they hope to do one day. And nobody expects a 15 or 16-year-old to know what they want to be forever, right? Sometimes I don't even know what I want to be.
Yeah.
But to have an idea of healthcare is the path for me, or I think I want to be a nurse. And one of the things we found is some students have participated in the program and have joined the program thinking, I want to be a nurse. And then we expose them to different things in the hospital and different programs, and they realize they actually might be interested in a different career in healthcare. We also, again, I mentioned this already, but we want people to know there's more to career in healthcare. And depending on the organization you're with, there's so many opportunities for advancement. So we have IT, we have marketing, we have a digital marketing group, we have finance, facilities engineering, environmental services, culinary arts.
Oh, yeah.
So in addition to clinical, there's so many pathways that students could really gain in understanding what a healthcare career can look like.
That's awesome. This is a great opportunity. So I hope we have some students who have interest. And I'll just ask one more question, and
Sure.
that is, so is there anything else you want to add?
I would say if you really are interested in a career in healthcare, there are so many opportunities right now. There really is a shortage of healthcare workers. So start looking now at what opportunities are out there. There's pathways where you can start getting your CNA certification now. A lot of programs will offer that for you for free. Be open to different possibilities and be willing to explore different careers in healthcare, and don't just pigeonhole yourself into thinking you have to be a doctor or a nurse or a physical therapist. There's so many opportunities out there, and explore what those might look like and find the one that best fit your personality and your skills and your experience and what gets you excited to get up in the morning, what you want to do. Because at the end of the day, for me, I want to feel like I've made a difference somehow. And sometimes all that is I help somebody find their way in the hospital. It's as simple as that. Somebody that's lost here, and I was able to get them where they needed to go. And I can go home and go, okay, I did something good today. And if you can walk away from your work day every day and be able to say that, you've had a good day. I really do believe that.
Absolutely. Well, thank you for your time. I appreciate it.
Thank you.
The deadline for this is the 28th, though, so
Yes,
we need to get a move on. So,
yes.
So again, I appreciate it, and thank you for your time.
Thank you. I hope you have a great day.
Yes, ma'am. Have a good one.
You too. Bye-bye.
Bye.